Thyroid gland. Okay, where it is, what are its function, what does it do, what does it do, we'll be discussing physiology. Let's look at it. Thyroid gland. I will have to remove myself. Yes. Let's move to this view. Okay, so where is the thyroid gland? It is present in front of the neck, below the trachea, and it is hugging basically like this. It is hugging the trachea and larynx. It has two larger parts, the thyroid glands, lobes, two lateral lobes, and the one part that is joining them in the midline. This is called the isthmus. You can see isthmus is in front of the trachea. You are able to see the first tracheal ring, the cricoid cartilage. So it is present below the in the trachea. Usually tracheal cartilage is number 3, 2, 3, and 4. It is present in front of it. Its weight is mentioned in the books, and it is extending. It is extending. Lobe is extending all the way up to the thyroid cartilage also. It can be seen overlapping the thyroid cartilage just above the inferior constrictor, and it goes below to the root of the neck and sometimes even into the interior mediastinum. So this is what the thyroid gland, where it is present, what are its structures, and what is its extent, roughly 25 gram in weight, and it has three parts, the two lobes that we just discussed, the isthmus, and not always present, but there may be an extension from the left side of the midline going up towards the midline that is called the pyramidal lobe, and it is usually absent or very small as shown right here. A very small pyramidal lobe is shown right here. So this is what the thyroid gland. It's from the thyroxine hormone T3, T4. You have studied that in your endocrinology lectures, right? In of yesterday, I think. And let's talk about its coverings. It is covered with the pretracheal fascia. It's a very common MCQ. It is covered in the pretracheal fascia, and pretracheal fascia it's attached to the tracheal rings and the larynx with the help of suspensory ligaments of Berry. Anteriorly, thyroid gland is related to the manubrium sterni. Anteriorly, thyroid gland is related to the manubrium sterni and the muscles between them. So the sternum, basically manubrium sterni becomes below the thyroid gland. So the strap muscles that are moving above, they passes over the thyroid gland to reach their original point. So the strap muscles are in front of it. Sternohyoid, sternothyroid glands are present in front of it. Medial to the thyroid gland are the structures it is hugging. Which structure it was hugging? The respiratory structures in front and digestive structures in the back. The respiratory structures include the larynx and trachea, and on the back of the larynx there was a pharynx, and on the back of the trachea there is a esophagus. And in addition to that, there are laryngeal veins. The ones coming from down are recurrent laryngeal nerves, and one coming from up are superior laryngeal nerves, and the part that is outside the larynx, the superior laryngeal nerve, that is called the external laryngeal nerves. And the medial relation can also include the muscles covering the pharynx and larynx. That includes the inferior constrictor of for the pharynx, cricothyroid for the larynx. So these are the structures that are related to the medial aspect of the thyroid gland. And posteriorly, you can see that this is running common carotid artery, this is running internal jugular vein. So posteriorly, thyroid gland is related to the carotid sheath and all its contents that we just discussed. The deep cervical group of nodes, common carotid artery, internal jugular vein, vagus nerve, and deep cervical nodes. So this is about thyroid, and thyroid gland is supplied by, to show the picture, it is supplied with a set of arteries, thyroid superior, inferior, and thyroid artery. To show you the superior thyroid artery, I will move to the slide behind. So this is the superior thyroid artery, the first branch when counting from downwards from the external carotid artery that comes down and it supplies the thyroid gland. We discussed all of it, the branches in the arterial section. We talked about the infrahyad branch, the branch going to the internal branch, the external branch going to the thyroid gland, and it is further dividing into the anterior division and the posterior division going to the back. And this is the superior thyroid artery. The thing that has to be remembered here is that the relation with the nerve. You can see just behind the artery there is external branch of superior laryngeal nerve. So this is the very important relation to be remembered right here. So this is the artery that nerve that is near the artery, superior laryngeal nerve. And during thyroidectomies, you have to ligate this artery. So it happens if the surgeon is not careful that the superior laryngeal nerve get tied up in the knot, get ligated along with the artery also. So you have to remember very carefully the relation of the nerve with this artery. And then there is posterior inferior thyroid artery. It is a branch of thyrocervical trunk we discussed in detail, and it is coming thyrocervical trunk. It is the upper branch, and this moves medially in an arc behind the carotid sheath, and it goes to the inferior pole of the thyroid gland. And then we are left with thyroid artery. It is not shown in these pictures, but sometimes it originates from the brachus electron. Right here, it goes up, and sometimes it originates from the directly from the arch of aorta, and from the arch of aorta it moves up and it supplies the thyroid gland in the midline. It is a very rare artery that is not usually always present, but this is one of the arteries. Veins, we have superior, middle and inferior thyroid veins. Again, these are more visible in this picture. Superior and middle thyroid veins. Superior thyroid vein, it goes to the internal jugular vein. It may go into the facial or lingual vein also, but it usually goes into the internal jugular vein. The middle thyroid vein, it does go into the internal jugular vein by passing, and both of these, while going to the internal jugular vein, they are crossing in front of the carotid artery, common carotid artery. And the inferior thyroid vein, it is going down to the brachiocephalic veins. So there is a paired internal thoracic inferior thyroid veins, and the inferior thyroid veins are different from the thyroid artery in the way that thyroid artery is very rare artery, it's single, it's not always present, but here they are very constant and both are going into a very constantly into the brachiocephalic vein. So this is about the thyroid gland and